on your favorite radio station, IKD 106.1 FM. You know how we do it every Monday through Friday, where we discuss issues around our society, our community, and our nation at large. But then, of course, every Thursdays we set this aside for health conversations where we orientate one another and, of course, educate ourselves when it has to do with health issues. My name still remains the same, Adebambo, or Bayami, saying welcome to the issues today. I'm not alone in the studio. You know how we do it. And of course, I should say a very big thank you to Ikorodu General Hospital for always doing good justice to every of our Thursdays. I have my mothers in the studio and they give me so much joy with their bright faces and the beautiful smiles on their face. And I'm saying welcome to the issues on IKD 106.1 FM. Do not forget, of course, that you can join the conversation from anywhere all over the world via our website, www.ikd1061fm.ng. And of course, you can listen to us live and direct via Radio Garden from anywhere that you are. Today, we wouldn't waste too much of our time, as we all know that 27th of May is a day that is set aside for our children, to celebrate our children. But then, of course, we should also know that while we celebrate our children, while we marry and dine with our children, it is also very important that we have healthy conversations and how to train our children. Today, we've decided that our topic for today, our focus for today's conversation would focus on jaundice in children. Whether we like it or not, jaundice is a disease that spreads around children. And in a way or the other, so many people are already feeling comfortable. So many persons are relaxed with this so-called jaundice, knowing fully well that there are many things that is attached to this. To all of our listeners out there, I want to say welcome one more time. And at the same time, I should introduce to you our guest in the studio today. Right from my right-hand side here, I have Dr. Ewedemi Folasade from Ikorodu General Hospital. She's a consultant and a pediatrician from Ikorodu General Hospital. I say good afternoon to you, ma.
Thank you, presenter.
Yeah, good afternoon to you. It's good to have you in the studio today.
Yeah, thank you so much.
I must say you're looking so good.
Thank you.
All right, by my left-hand side, I have another mother in the studio in person of, she's a nurse, the Chief Nursing Officer at Ewedemi General Hospital, no other than mother, I call her mother, Nurse Moshood. Yetunde, good afternoon to you, ma'am.
Good afternoon.
It's good to have you in the studio.
Thank you.
So like I said earlier, today we talk about jaundice in children. We know that jaundice is a disease that is across. When it comes to children, jaundice, you can't take it away from children. It happens a lot. But the first question I would like to ask you, let me come to you, Dr. Folasade. When we talk about jaundice, what is jaundice exactly? So many people cannot even really define or explain what jaundice is, but they all know that there is a disease called jaundice. So I would ask you, for the sake of our children out there, for tomorrow, 27th, what exactly do we call jaundice?
All right, thank you very much. Jaundice is simply what a lot of people, whether you are medical personnel or not, can actually identify.
Okay.
But the issue is now how they go about treating it. So I would say that jaundice is simply the yellowness of the eyes, of a child. Now, this yellowness usually just starts from the eyes, can actually cover the whole body. So jaundice is essentially the yellowness of the eyes, the face, and any other part of the body of a child. Starting from when the child is just born up to whatever age.
Okay, it starts from when a child is born. It's not as if some would say that until maybe the child gets to about 1 or 2 years of age.
Well, yes, but it actually depends on what is causing the jaundice for that child who is 2 years old or 3 years old. If a child is SS, for example, the ones we call sickle cell, they can have jaundice at any time of their life. In fact, even adults can have jaundice. Anybody can have jaundice.
Even adults can have jaundice.
Exactly. Anybody can have jaundice. But today, because of the period we are in, the merriment of Children's Day and all that, so we are focusing on jaundice in children, starting from even when a child is born.
Just like I said earlier to our listeners out there, tomorrow is Children's Day. And yes, of course, we are celebrating our children from all over the nation. And Ikorodu General Hospital have also decided that, yes, while we celebrate our children, it is also key, it is important that we have an understanding of what jaundice is, jaundice in children. So I come down to you, nurse. When we talk about jaundice, what exactly causes this so-called jaundice? I have seen children with this jaundice, the yellowness of the eyes, just like the doctor said. What exactly causes jaundice?
Thank you. Some of the things that causes jaundice include a situation whereby a baby is born and the baby's blood does not matches with the mother.
The baby's blood does not matches with the mother.
Yes, that's when we are talking about ABO incompatibility. or resource incompatibility. Then premature babies are also predisposed to having jaundice because most of their organs are not fully developed. The premature babies are babies born before the 37 completed weeks of pregnancy.
Okay.
So their organs are not fully developed, so they are predisposed to having jaundice. Babies who are not adequately fed, either breastfed or formula fed, they are also predisposed to having jaundice. Then babies whose mothers are having some forms of infection like hepatitis, they are predisposed to having jaundice. Babies who are also born with internal bleeding.
Internal bleeding.
Yes, babies who have internal bleeding where there's excessive outflow of red blood cells and there will be a buildup of bilirubin in their system, they are also predisposed to having jaundice.
Oh, okay. I want to say thank you for that, for all of those. At the point I got lost with all of those medical things that you gave. I would have loved you to break that down. But still on you, I will still stay with you, Nurse Moshood. When we talk about these causes, does it really have to do with a kind of a particular environment? Some believe, some say that people on the mainland, when I say mainland, not this part of Lagos, I mean the local areas, the trenches, so to say, are the ones that are affected with this so-called jaundice. But when you come to the rich people, the well-to-do persons, the higher class persons, they don't get infected with jaundice. How true is this?
Yes, I can agree on that with you because most people living in the trenches, they are people of the low socioeconomic class.
Okay.
Some of them are ignorant of this condition, neonatal or jaundice.
Okay.
Some of them, even when they are aware, they are negligent because some of them find themselves like they feel like they are helpless. So they just allow the condition to keep going until it becomes a menace. Some of them that are also living in the in the trenches.
Yeah.
I said they are from low socioeconomic class. So some of them don't have finance.
Okay.
Finance can also be a burden for them to approach the health center or or a government owned or accredited facility to be assessed and treated.
Okay, so doctor, I'll come to you on this one. Jaundice in children. Sometimes when this so-called jaundice comes, parents just feel like this is it. It is normal. As a parent, what should be the first step to take? We're not talking about the preventions now. Some will just sit and they just say, jaundice, like the Yorubas will say, normal. What exactly should be the first move of a parent, not just the mother now, when you discover that your child is affected?
Exactly. Well, for start, it's not something that it doesn't spread from one child to another. Do you understand?
Okay.
Now, one of the things that can also cause jaundice, we like I said, why we particularly chose this topic is because you cannot talk about under 5 children, for example, 5-year-old, 4-year-old, if the child has not survived the neonatal period. The neonatal period is a child that is born now up to a 1 month of life. There are a lot of turbulence that can happen at that period. So if a child doesn't survive that period, of course, you are not talking about a 1-year-old or a 2-year-old. So let's start from the basis.
Exactly.
Now, so if a child is born and then the child develops jaundice, yellowness of the eyes. Now, whether it is the grandma that notices it, because a lot of times the first timer mother may actually not notice it. So it may be people around that will say, it looks as if this your child has yellowness in the eyes. Now, a lot of people think that they know how it is treated. And so because of that, when they see it, they just start doing all sort of things. But the first step that anyone should take, especially for your child who is newly born, is that you present yourself to a hospital where they will assess the level of that jaundice, because sometimes this jaundice would not need to be treated because it's so small.
Doctor, if I get you correctly, you're saying that some jaundice might not need to be treated.
Yes.
Wow.
I'm talking about, we're starting from the basis now.
Yes,
for
yes.
a child that is just born. The child comes out today, born on Monday, on Tuesday, and on Wednesday, they just this child is jaundiced. Truth is that some of these jaundice will not need to be treated. You understand? So, but how would you know the one that does not need to be treated? Except you present to a hospital, there's no way to know. No, even doctors may not be able to know. Unless, yes, you will come to the hospital, we'll look at the child. This jaundice seems not too much. But then, medicine now is evidence-based.
True.
So we will look at the child clinically and then we'll send you to the laboratory. You will perform the test. And then we'll see, this level of jaundice is not bad. go home. Do you understand? And maybe come back next day, we'll repeat it. So sometimes we have to repeat the level like 2-3 days and we say, this is fine, just go, no treatment. Do you understand? Now,
Very.
it is this kind of jaundice that will go on their own, even if a child had presented in a hospital. These are the types that somebody will say, oh, when I had my child last year, my child had jaundice, I used pawpaw water, the thing cleared. My friend told me to use ampiclox,
I was
cleared.
about going there.
Exactly. They use early morning sun, it cleared. It is not true. All these ones can never treat jaundice. The only jaundice that will disappear when people do all these things are the ones that, even if you had presented in a hospital in the first place, we wouldn't have treated.
Wow.
We would have said, go home.
Okay, doctor, I must say you're doing justice to this conversation. Now, if you're just joining us, is the issues on IKD 106.1 FM. The conversation is getting more interesting with my doctor Folasade and of course Nurse Moshood Yetunde in the studio. I'll stay with you, doctor. Some persons will say that for me in my family while I was a child, I was affected with jaundice. I experienced it. My mother experienced it. My forefathers experienced it. Some will even tell you their forefathers and all of that. Is jaundice hereditary?
I would not say.
Because some will just tell you that
Yeah.
they will just tell you that is how it happens. Is it actually hereditary?
You having jaundice, how old are you? What is the condition causing your jaundice?
Okay.
Do you understand? That's when we will now say that, okay, the condition causing your jaundice, maybe that condition is hereditary. Well, maybe. Do you understand? But jaundice in itself is a sign that there's a problem. Do you understand? That is a problem. It is not the problem itself. So when you see anybody from a newborn to any age having jaundice, you'll now be finding out, okay, what is the cause of your jaundice? You understand? It's not as if the jaundice is actually the problem. It's just like a child has temperature, somebody has temperature. The temperature is just showing that there's a problem. The temperature is just showing that, oh, maybe you have malaria, maybe you have some infection. So jaundice is actually showing that, oh, check this person out, there just may be a problem.
You heard doctor, she said jaundice is just a sign that there is a problem, and that is the major thing, not actually the sign. So I come down to you, nurse. Is it possible that a child will escape childhood without jaundice? Because it is believed that jaundice is for children, and so definitely a child should. Some will even just say that, I'm not a jaundice, or what's going on? I've not seen this. Is it possible that a child could grow and escape jaundice without having it at childhood? How possible is that?
About 60% of full-term babies, they are predisposed to having jaundice.
Great.
So because of that, majority of babies are having jaundice. But there's also an exception of people, just like my consultant pediatrician said, there are some people that within 1-2 days, the baby's jaundice has gone down. So it may also be possible that some babies do not have. I've seen babies, I've nursed babies that they didn't even show any sign of jaundice and they were discharged home and they didn't come back to the hospital for any complaints.
Wow, so it's actually possible.
Yes.
0904081161 is the phone line. While we are celebrating our children tomorrow, it is important that, of course, we keep them healthy. 0904081161 is the phone line. Jaundice in children, you have the opportunity to call in and, of course, ask questions or making contributions. We have the medical practitioners in the studio to do justice to your question. IKD 106.1 FM is the station. Doctor, I come down to you. Some will tell you that, just like you said earlier, you mentioned pawpaw water. There is this other one you mentioned that I'm trying to remember.
Early morning sun.
Early morning sun. They will tell you early morning sun. And some will just tell you that when it is jaundice, you don't need to go to the hospital. Now, I don't need you to speak as just a doctor. I need you to speak as a medical practitioner. How true is it that all of this early morning sun, pawpaw water, or pawpaw leaf, or whatever it is best than the medical treatment?
Pawpaw water, early morning sun, use of ampiclox, generally they just believe that, now because like I told you, I said there are some jaundice in babies that are newly born that would naturally not be too much and then it will disappear by itself without any form of treatment. Now, those are the kind of jaundices, that some babies will have. And their parents will not come to the hospital. And then they will put the early morning sun, the thing will disappear by itself. Because sometimes some will have a natural issue, as in the jaundice will start by a particular day of light, gets to the peak and then starts disappearing. Those are the jaundice that we call physiologic, as in, normally when a baby is born, their blood level is very high. As higher. Yours may not be more than 40, 45 as a man. Mine may not be more than 35, 40. Now, when a child is newly born, their blood level is so high. 60%, 65%. That's normal for a newborn, for a newly born baby.
It's normal.
Yes, for a newly born baby. That's what they need inside the womb. That's why God made it like that. Now, when they come out, they don't need that high again. And so it has to come down. Now, the way the blood level will come down is not by the baby vomiting blood, or passing out blood. The only way it will come out is for their body to break down those red cells. Do you understand? So, when the red cells are being broken down, that's when this thing we call bilirubin comes out, that yellow thing. It is the same yellow thing that makes our stool yellow, that makes our urine also have some kind of yellow color. So it's a normal thing that a lot of babies will have jaundice. But the issue is now that which one needs treatment, which one does not need treatment. Now those purple water, MP+ and all that will never work for any form of jaundice in the neonate, in the child that is just born. It won't work. You know why we are so passionate about speaking about jaundice? Because we see a lot of babies that were born normal by God, as in created by God well. And this child goes home, develops jaundice, and somebody said, last year my own baby too had jaundice. I used the purple water, I put inside some, it disappeared. Not knowing that for this child, it's the type that actually needs treatment. And so they go on using all that. And the first time they will come to the hospital, it's just normal. That's the way they come. The child has refused to suck again. The child that was otherwise well before was sucking, has even gone for immunization and come back. They say the child is no longer sucking. In fact, Yorubas want to wait till the naming ceremony. They are seeing the jaundice. They say if you go to the hospital, they may just admit the baby. Or they plan that after naming ceremony they will come. Unfortunately for them, naming ceremony day they will rush the child to the hospital. Why? Because baby has refused to suck and it's already, we used to call it riding bicycle. Why are we so passionate about jaundice in the neonates? It's because it destroys their brain when it needs to be treated and it is not treated. In fact, of course, it kills them. And for those that who unfortunately do not die, after the thing has scattered their brain, they don't die, then you have just simply collected a liability. A child that you will nurse for the rest of your life. A child that is retarded can never be like other children. Imagine a 5-year-old is not sitting yet, let alone crawl, let alone walk. Is that the kind of child that will go to polytechnic or university? It's not possible. Cannot become governor or president. That's what we are talking about. When your child develops jaundice, please come to the hospital. The commonest type of jaundice that children will have is the type that if we don't treat, the only 2 ways to treat, either you put the baby under our own kind of light in the hospital, which we call phototherapy, or we exchange the baby's blood. Those are the only 2 ways of treating jaundice. The blood will be exchanged. We'll have a way to do that. Or we put the baby under light and you go on with a safe baby that has sense, whose brain is still very intact. You understand? So those native things, it will never work for jaundice. Now, those that claim it works, do you understand? They are the ones that if you had come to the hospital in the first place, we wouldn't probably have treated. It is the type that is small level, as small as per level, and then will disappear on its own. So anybody, your child development, please come to the hospital. We will not always admit. And when we need to admit, please look at the bigger picture. International Children's Day, they say, is it save our future? Saving your future is saving your children, something like that. So when we talk about your future, we're actually talking about taking care of your children well.
Yeah, it is true. The children are the future leaders of tomorrow, and that is actually very, very important. Now, you said something earlier. I'll still stay with you. You said the reaction of jaundice on child A might actually be different from the reaction of the jaundice in child B.
Exactly.
Are you saying that there are types of jaundice?
Oh yes, there are types of jaundice. There are levels of jaundice.
There are levels of jaundice too.
There are levels. Levels in the sense that yours may be very small, yours may be very high. That's what determines how we will treat. If yours is very small, we're talking about a child that is just born now. If it is very small, then you probably may not need treatment. If it is very small also, you probably may not need to be put under lights. If it is very high, you probably have to put the baby under light or exchange the baby's blood. That's as per levels, different levels. As per types, yes, there are types. One type is the type that can scatter the baby's brain. The other type is the type that can destroy the baby's liver. So until you come to the hospital again and we do the test, we will not know whether the one this child has is the type that you should go and do surgery, operation.
Wow.
Is that how,
get to that?
Oh yes, it could get to that because there are types of jaundice. There's the type that will destroy the baby's brain. You see that one that will destroy the baby's brain, the only way to treat is to either exchange the baby's blood or put the baby under light. But you see the type that will destroy the baby's liver, they will not say, this baby needs liver transplant. The way people need kidney transplant. This baby needs liver transplant. That type is another type. Unless you come to the hospital, no way to identify which type the baby has.
All right, of course, it's still the issues on IKD 106.1 FM. We'll go on a very short breather. When we return, you've heard how dangerous jaundice could be. It could affect the brain, it could affect the liver. When we return, we look at how to prevent, if at all, we could prevent jaundice. IKD 106.1 FM. We'll be right back after this very short break. Don't touch the dial. Yes, of course, you're welcome back to the issues on IKD 106.1 FM. I must tell you, I, for one, am really being enlightened here in the studio where I have Dr. Ewedemi Folasade, consultant pediatrician of Ikorodu General Hospital, and of course, Nurse Moshood Yetunde, chief nursing officer, and of course, a pediatrician from Ikorodu General Hospital as well, while we talk about jaundice in children. Do not forget, of course, that you can join us on our social media platform. Of course, also on Ikorodu General Hospital on YouTube, Facebook. You can watch this live if at all you decide to watch this after now. And of course, you can join us on our website, www.ikd106.1fm.ng. The phone lines are very much open. 0904 1061, 0904 Of course, you can send in text messages or WhatsApp messages to 0904 We continue with the conversation, and I come down to you, Nurse Yetunde. When we talk about jaundice in children, can we prevent it? Are there preventive measures to jaundice?
Yes, thank you. There are preventive measures to prevent cases of neonatal or jaundice in children.
Okay.
One, it starts from pregnancy. We are advocating and encouraging the general public that our pregnant women should visit a government-owned or government-accredited facility to register during their antenatal days,
Okay.
so that in such hospitals they run tests, they do blood investigations on them to check their blood group and also their resource factor, because this is one of the reasons or predisposing factor to jaundice in children. Then we also advocate that in pregnancy, our pregnant women should desist from taking alcohol, because alcohol has an effect on the liver and it could prevent the baby's liver also from functioning well. So we are advocating that our pregnant women should not take anything alcoholic like bitters. Most of these bitters have a form of alcohol in them. And because most of them patronize traditional bath homes, they encourage them there to also take alcohol, and this has a negative effect on the liver of the children. Then we are also advocating that in pregnancy, we should encourage our pregnant women not to go through a lot of stress, because stress is also a predisposing factor to having premature babies, premature babies. So in such condition, if they are not too stressed, they are not having premature babies, and so the life expectancy of these children is also elongated. Then also in pregnancy, when they visit a government-owned or government-accredited facility, they are treated for infections like malaria, hepatitis, so it doesn't go on to affect their babies. Now, after delivery, we are encouraging and advocating that our mothers should desist from the use of early morning sun, the use of Ampiclox and Zinat syrups, the use of putting breast milk, dropping it into the eyes of the babies. I've seen a situation whereby the mother dropped breast milk into the eyes of the babies, and the baby's eye became so septic, we had to be cleaning and adding eye drops before the baby's eye got clearer. Then, just as our consultant pediatrician said, as soon as you have a baby, please ensure that a medical practitioner assesses that baby for neonatal jaundice before you are being discharged from the hospital. Then, if you have a premature baby, some of them take the premature babies home and start doing all sorts. Despite the fact that 80% of premature babies are exposed, they are predisposed to having this neonatal jaundice. So if you have a premature baby, a preterm baby, a baby born before the 37 weeks of gestation or before 9 months, please take these babies down to the government-owned or government-accredited facility so that they can be assessed. Just like in the hospital setting, if we have a preterm baby in our hands, after 24 hours of life, we start for prophylactic phototherapy for them, because we know that they are at high risk. So before the jaundice even starts appearing, we have started combating it. We also encourage that people do not use camphor balms. These are things that can also predispose a baby to having neonatal jaundice. Now, studies have shown that like in a condition like G6PD, that there's an enzyme deficiency. Some of these babies are exposed, but when their mothers use camphor or balm,
Yeah.
you know, when you have like 10 children around, you don't know which of which can be asthmatic among them.
Exactly.
So if you have 10 babies, you don't know which can be reacting to all this camphor
Balm.
or balm.
Yeah.
So we are encouraging that our mothers desist from the use of all this. So in cold weather, we advocate that you can wear them hand gloves, you can
Yeah.
wear them socks, you can wrap them warmly with a thick shawl. Then we also encourage our older mothers, because sometimes the younger mothers may also know, and they may want to take the babies to the hospital, but you see their grandmothers or the mother-in-laws may say, no, I trained your husband, I was the one that took care of him till he's of this age, so you can't be telling me what to do. So we are encouraging our older mothers to also go in line with this. Some of them should also encourage younger mothers that these children, these babies, must visit the hospital for assessment. Then it's also a clarion call to our fathers. Sometimes the mothers want to take the babies to the hospital for assessment by a medical practitioner, but you know there's a tradition. Some cultures have tradition that a mother cannot take a baby to the hospital without the consent of the father.
True.
So please, it's also a clarion call to our fathers to please, even as you have babies, you should also encourage the mothers to visit the hospital. Some mothers may want to go, the fathers will say, no, I don't want to take my child to the hospital.
I was not trained that way. I wasn't brought up that way.
Yes. So please, it's a clarion call to our fathers to also encourage our mothers to take their babies to the hospital for them to be assessed for neonatal
Thank you
jaundice.
very much, Nasa Yetunde. I come down to you, Thepta. You know, before I ask about just treatment measures, some parents will tell you that the reason I do not want to visit any hospital or any medical center is basically because the procedure and the expenses to treat jaundice is actually very expensive. How true is that, doctor?
Well, as per the time spent, right?
Yes.
Well, I would say that at General Hospital Ikorodu, we're working so much, to ensure that time spent to access care is reduced, to as much as possible. Apparently, we queue up at supermarkets, to pay for whatever we buy. We queue up in banks. In fact, when COVID came, we will sit for hours on end in banks, to get transactions sorted. So now to seek help, time spent cannot be too much, But then I agree to the fact that yes, as per timing and all that, but that's what we are working, towards, as making it as pleasant as possible for people who come. But as per expenses, of course, the same people who say this visit private hospitals, for example, and there's hardly any private hospital that will be less expensive compared to government. So government is still in General Hospital Ikorodu, a lot of, in fact, especially for children. When adults pay 4,000 naira, children will pay 2,000. When adults pay 1,000, children will pay 500 naira. So they pay less. You understand? So as per money for children that we have come to talk about, I would not particularly say that the monies are not pocket friendly. Yes. So please visit us. You will realize that we have worked so well as per timing. We won't waste your time. And as per the finance, if you have visited private hospital before, come check us out. You will realize that definitely the difference is clear. Now, what I wanted to talk about, my colleague was saying some medical things that is only us that will understand.
Exactly.
Now, mothers, when you visit hospital, they will do your blood group. You see these mothers that are negative. You do your blood group and you say you are O negative, A negative, B negative, AB negative, anything negative, you are a special case. You understand? Your babies are very special. Your own babies don't even have to develop jaundice before we take the baby's blood and check out for them. Because for you, your baby can develop jaundice while the baby is inside the womb. So if you are told by any chance, you are the type that should be collecting Rogam, whether you voluntarily terminated a pregnancy before or spontaneously went down, you had a miscarriage. At such points, you should have what we call Rogam injection. Because if you don't take it, there's a way, if further later you now start getting pregnant, your baby's blood and your blood mixes somehow, your baby's blood will now start fighting you, as in there's a fight like that between your baby's blood and your
And your
blood,
blood.
so that the babies can develop bad jaundice, so that right inside the womb, before the baby is born, baby develops bad jaundice and then might even die inside or as baby comes out.
We have less than just 5 minutes to sign out from the studio. But then, nurse, I come back to you. There are so many statistics shows that over 60% of our mothers now have a way of treating jaundice. Let us not forget that one of the reasons why you're here today is to orientate the general public. That is the awareness we're trying to create. So many persons out there do not know the right procedure in treating jaundice. How true is this? The methods at which people handle jaundice in Nigeria. How has it been so far with the experience you have as a nurse?
I found out that people use all these harmful or bad practices, and which is causing a menace to our children, because our children are the leaders of tomorrow. So we need to take care of them well today, so that they can actually become the senators and the governors that we want them,
And the presidents.
and the presidents. Thank you, that we want them to be. We found out that they use ampiclox, Zenat, early morning sun, and then drop breast milk on the heights. These are not the world is evolving, so we need to revolve. We don't need to in times past. Most of us have gardens at our backyards where we plant vegetables, but now they are manure produced, they are chemically produced. So the world is revolving, so we need to revolve with it. Those things are no more scientifically based, they are no more effective, just as the consultant pediatrician has said. So what is in vogue now is that as soon as you have a baby, whether full time or term, please visit a hospital, government owned, government accredited facility, so that your baby will be assessed. Then when they check the serum bilirubin level, they know whether you can actually go home or be admitted. The baby will be admitted in the hospital and then placed under phototherapy light.
All right, this is a very beautiful way to sign out on the show today. But then, Dr. Folasade, your parting words to all listeners out there, especially our parents, on jaundice in children.
All right, thank you very much. I would say that, just like we have been saying all this while, please, you give birth to a child, watch out for jaundice because it's quite common. No other thing we treat jaundice. It's only if we put the baby under light or we exchange the baby's blood, or it wouldn't even need treatment. So please, register in a good facility when you are pregnant. And then as soon as the baby is born, know that jaundice is very common. Whether it needs to be treated or not, it's very common. And so, come to a hospital, we help you look at the baby, we'll do the level if the baby has jaundice, and we'll determine how we treat it. Because I'm sure you want your child to be mentally sound. You don't want to start looking for donor for liver if it is that type. Please come to a hospital so that you not develop mentally retarded babies. It's Children's Day in Nigeria, so please let's treat them well.
You've heard from our doctor. It's Children's Day. Tomorrow, 27th, will be another beautiful day to celebrate our children all over our nation, Nigeria. And of course, our mother who has treated so many children. It is not wrong for me to say you're a mother of many nations. Nurse Moshood, Yetunde, your parting words to all of our listeners.
Thank you, presenter. My parting word to the general public is that we are pleading, we are advocating, we are begging our mothers and our fathers to please, just as we have said, visit a hospital to have your baby checked. Let's stop the use of early morning sun, dropping breast milk in the highs, and use of ampiclox and Zenat syrup. Let's move with the world. As things are changing, let's change. Our babies too, before you don't have, many people do not have a higher level. But now things are changing. So let's change with as the world is changing. So please, to avoid mental damage, cerebral palsy, and physical and mental handicap to our babies, to our children, please make sure that your babies are assessed for neonatal jaundice and they are treated when necessary. Please, let's stop the use of all these bad and harmful practices that can mentally or physically derange our children. Thank you.
This is how far we can go today on the issues. I want to say a very big thank you to Ikorodu General Hospital for always doing justice to every conversation. My name still remains the same, Adebambo or Bayami. And of course, I say thank you to Dr. Ewedemi Folasade, consultant with nutrition, Ikorodu General Hospital. And of course, Nurse Moshood, Yetunde, Chief Nursing Officer. Thank you so very much. Please, my regards to all of the bosses in the Kogi General Hospital. Tell them that I love them. And of course, happy Children's Day to all of our children out there for
Yeah.
tomorrow. Thank you so very much. God bless you.
Thank you.
IKD 106.1 FM is the radio station. Let's do it again tomorrow, same time, same station. For now, it's a bye. God bless Lagos. God bless Nigeria. God bless the beautiful people in the Kogi. It's a bye for now.